Hello, I'm Sarah Strackhouse, and I have the opportunity to sit down with John R. Roland, MD, who is, of course, on the board of directors of the American Association of Stem Cell Physicians. How are you, Dr. Roland?
I'm fine. Thank you very much for having me.
Absolutely. So we're so excited to hear about your conference that you just recently went to. It was a national conference. You were a speaker. Can you tell us a little bit about it?
It was a great opportunity. Stem cell research is really coming forward in so many different ways, both the research and some hands-on skills that we can start to help patients right now. Not start, we have been helping people, but this has been a real opportunity to come together and share the good ideas that we've had and the good experiences that we've had with our patients, and then to start teaching each other our techniques, and then embarking on the future and trying to make headway into where we need to go.
Absolutely. It sounds fascinating. And for those of us who might not have too much knowledge on what stem cells are, can you tell us a little bit about that, and then also how they're used in medicine?
So stem cells are multipotential cells, and we have them everywhere in our body. And they're capable of turning into any type of tissue in your body. So our body gets injured by a number of different issues, a number of different processes. And the body heals by triggering these stem cells to come forward and start healing and replacing the things that are not working. But we're learning so much more about those. We are finding that we can get them from a number of different tissues, and we can apply them to help reverse some of the degenerative diseases that are going on. They're affecting our bodies. So this is really the science of how to do that.
So would this be able to help something like arthritis?
Well, yes, and there are clinics that are popping up all across the country using stem cells. And we've had the most success using them to help with arthritis. And we can help them with major joints. We anticipate that, for instance, the use in knees will help to give patients a great alternative instead of having total knee replacements, for example. But it's now being used for degenerative arthritis in the back. And we can inject it into the joints like the facet joints, which are those, they're kind of like shingles. They slide back and forward upon each other. But now we have techniques, they're pain medicine doctors that are demonstrating that we can take these stem cells and inject it into the disc of someone that has had severe arthritis, so much that the disc has degenerated. The bones are literally collapsing upon one another.
Wow. And
so we're taking these stem cells and injecting them into the disc, and months later, the disc is regenerating.
It's incredible.
So, it leads to this concept that it's actually reversing some of the aging process, if I could be so bold as to say that, but clearly these joints look younger.
Wow.
And we're seeing examples in other areas too. Yeah.
And as you were talking in your speech, we were listening to that, and it was fascinating some of the other aspects you were saying that stem cells could really help with. What about something like brain injury? I understand you talked a little bit about that.
There was some very exciting research about using stem cells to try to help with brain injuries. And there are a number of opportunities and some progress there. Some of these researchers are using stem cells and injecting them into the arteries of damaged areas of brain. And some of the stem cells are taking up residence in there and helping that brain tissue heal. We'd like more response there. We're not having as great a response as we would like, but it's a beginning, it's a start. But we are seeing, for example, that there are great inroads of using these stem cells to help brain injury patients recover. And brain injury is really a very diffuse injury over a wide area of the brain. So there's true opportunity. And again, we're learning more and more about how it is to get these stem cells there, that's important, and then maybe even which types of stem cells to use in the future.
Well, where do you get these stem cells? You're talking about type of stem cell. You know, for those of us who, again, might not know a lot about stem cell usage, where do they come from?
Yes. So you have them everywhere in your body.
Right.
And originally we were using them from bone marrow.
Okay.
And we can get them from there. And we use a needle to get down to the middle part of the bone and pull back this liquid part of the bone, and it's loaded with stem cells that are able to regenerate, for example, your whole blood system.
Wow.
But you can take those bone marrow stem cells and inject into knees, and you can rebuild, well, help to reverse the process of arthritis, which of course we were talking about. Mm-hmm. Or into the disc spaces, or to the facets, all of these areas. But we can get them from blood, we can get them from bone marrow, and we can get them even from adipose tissue. And there we get into some controversy. There have been some concerns about safety with using adipose tissue, and we're learning more about that. And we want to work with the FDA, and we'll talk more about that in one of the other segments.
Sure.
But even in fat tissue is loaded with stem cells. So I don't want to go on too longer, but the surprise is that we can even use my bone marrow, let's say, to help disease in you. Or maybe, since you're younger than I, using your tissue and helping me to heal.
Wow.
Your tissue, you being young and more vibrant, your tissues are going to be more vital, more alive, and more able, frankly, to help me regenerate. So it goes even beyond that. We're now learning that we can use placental tissue and umbilical tissue and Wharton's jelly, all that are loaded with stem cells, and being able to use it in multiple patients. So if I'm dealing with an older person and their stem cells maybe aren't as alive as we would like, we have plenty of options. And frankly, we can use these, and they aren't causing the body to react because they're foreign tissue. So it's very complicated, but these stem cells, even umbilical cells that are not yours, if I inject them, they respond and coordinate with your own tissues and help wake up your own tissues so that your body starts to heal and repair. It's very complex, but it's really, really interesting that we aren't having those graft versus host disease problems.
Right.
And this is now being done in universities across the country, and University of Miami demonstrated a very large study at this conference showing that this is safe, that the safety studies are really being done out there. So it's opening the door then for such an expanded use of this.
So much healing.
Yes.
Yeah. So tell me now my question is, what's the process like to get these stem cells?
So if we're going to use, so certainly we can do bone marrow. I can pull the bone marrow out of you and inject it, let's say, into your joints or intravenous or various ways, depending on what I'm treating. But I can also go to stem cell banks. There are companies that are producing umbilical cells and are purifying them and freezing them and making them available so that I can use it. And so I don't have to do a bone marrow, obtaining your bone marrow to use this.
Right.
I can use an off-the-counter product to help treat these illnesses. And so, and if I can, let me extend that a little bit. I've talked mostly about joints and arthritis and muscles and tissues, and it helps with that. But incidentally along the way, we're finding that it helps with systemic disease too. We're injecting joints, and we're seeing people's diabetes getting better.
Wow.
We're injecting joints, and we're seeing systemic disease like rheumatoid arthritis getting better. At first, we didn't really know how that is working, but now the mechanisms are starting to be understood, and that, frankly, is one of the things that I talked about in my lecture.
That's incredible. And as we were kind of listening through, I understand you also touched on a little bit how it can help with the eyes as well, which, that's part of how we make our memories, our happiest moments we see.
So I had the opportunity to sit down and not only befriend Dr. Weiss. He's an ophthalmologist and is one of the most renowned researchers about using stem cell to help with vision problems. And he astounded us all about what we can do with stem cells. Now, I don't want to overstate this, but he is making progress in people that have let's say, macular degeneration, that he's improving vision in these conditions that are supposed to be irreversible.
Wow.
He's improving conditions like retinitis pigmentosa and making some strides there. And so you kind of wonder why that would work.
Right.
And the answer is that these stem cells are loaded with growth factors. They're loaded with factors that affect, for instance, revascularization. So we can take these stem cells and improve blood flow to certain organs, like, in this case, the eyes and the retina. So clearly, stupendous progress.
Yeah.
Another condition that he talked about and that other doctors talked about too, one of the really bad conditions that we see is scarring of the cornea. The cornea is that clear part over the eye. And when it gets harmed with acid or actually even alkali, either extreme can injure it, literally burning the eye. It responds by scarring, and the scarring permanently impairs your vision. Well, there are ways now where you take that scar off, and then you're dripping periodically fluid that has stem cells in it, and it allows the cornea to regrow in a much better fashion. And so it's restoring vision by making it clear again. And he demonstrated some cases about that.
That's unbelievable. I bet that was fascinating to see and kind of hear about that whole conversation.
Yes, yes.
And I was listening as you kind of continued to talk further about exosomes and about the stem cell product. Can you tell us a little bit more about that as well?
I too, I get so excited talking about it. So far what I've been talking about are using intact cells to help to heal. So we kind of think about these cells going into a joint and helping it heal by turning it into a chondrocyte, which produces cartilage, right? Well, it turns out that we don't have to have even the whole cells. There are now products out there, and there's now more and more studies using not the stem cells, but we're using the things that are secreted from the cell itself. And these are the growth factors that I was talking about. And in some cases, microRNA, which it's genetic material that have special messages. And so we suspend it, we can concentrate it, we can take stem cells and stimulate them to produce this and put it into basically a syringe and then inject it where we need. So one of the astounding studies that was reviewed by a couple of different doctors, and I presented one of the papers there, in Egypt. They were using these stem cells and injecting it into the renal artery. This is the artery that supplies blood flow to the kidney. They injected into the kidney. These are patients that had some degree of kidney failure. They weren't completely dead, but they were sick and dying. And they followed them for a year, and they improved function by 25%.
Unbelievable.
Unbelievable indeed. And it wasn't whole cells. And the other thing about it, so this is just what the stem cells secreted. It wasn't whole cells. And they injected this, and they saw response for the entire year. So the effect of this injection lasted a whole year. Not only that, but in the broader context, kidney disease is not one disease. And so this injection of these products from stem cells were affecting not one, but many diseases that were clumped together causing this kidney failure. And so, as we'll talk about in the next segment, I reviewed some of the mechanisms by which these stem cells are helping to reset and helping the body heal. I mean, can you imagine? We are waking kidneys up, and kidneys are starting to respond. Now, I will tell you this is highly experimental,
Right.
and I frankly can't even tell you who in the country, in the U.S. are able to do these. But the fact is that these studies are coming out. These products are becoming available. And so now we have to step forward and start using them and start measuring our response. And that gets into the third part,
Right.
which is how our organization is going to help bring that about.
Absolutely. It's really, really incredible work and life-changing work, truly. Are there any other applications that you took away from this conference that you wanted to talk about or preview before our next segment?
So there are lots of applications about using stem cell for skin and anti-aging things.
Sure.
So we certainly can take these stem cells and mix them with fat and inject them underneath the skin and help to rejuvenate the skin, so-called facelifts. And these facelifts are truly remarkable. There are a number of ways of applying it topically to help rejuvenate skin. And so, you know, the skin it's thicker, it has better blood supply, it's younger. And so, you know, again, we try not to overemphasize this anti-aging aspect of it, but it does seem to have some youthful tendencies. It does seem to restore circulation. It does seem to restore function of the cells. We can use it for hair loss, for example.
Wow.
We can use it for cosmetic things. There were many presentations of people with horrible scarring from even plastic surgeries that have gone bad.
Sure.
And we use these stem cells to help rejuvenate the skin and reduce the scarring. It's amazing.
Unbelievable. Really a little bit of everything. So much, like we were saying before, life-changing applications. Incredible.
Yes.
Well, Dr.
Yes.
Roland, thank you so much for talking with us. Of course, we do have the 2 other segments coming up that you teased a little bit in there. And if people have any questions about how to reach you and make an appointment with you as well.
Come to the website, evolutionmedicinedallas.com. That's my website. And certainly go to the national website for the American Association of Stem Cell Physicians.com.
All right,
Thank you
thanks
for
so
having
much.
me.
Yeah, of course. Thank you so much for joining us.